Welcome to i-TUTOR Economics NCERT series. In the last class, we discussed the topic up to energy, where we saw how energy plays a vital role in economic development, and also we saw the differences between renewable and non-renewable sources. Now, let's go to the next part, that is health. Health is not merely the absence of diseases, but also the ability to realize one's potential. Actually, it is a yardstick of one's well-being and a marker of national development. So, health is linked to the overall growth and development of the nation. Improvement in health contribute to human capital, productivity, and social welfare. So, scholars generally use some indicators to measure health. Do you know what are they? Yes, infant mortality rate, maternal mortality rate, life expectancy, nutritional levels, and communicable incidence of communicable and non-communicable diseases. What is meant by infant mortality rate or IMR? It means the number of infant deaths per 1000 live births. What about maternal mortality rate or MMR? It is the number of maternal deaths per 1 lakh live births. Then life expectancy means average number of years a person is expected to live. Nutritional level means it is the prevalence of malnutrition and undernourishment. Disease incidence means both communicable, that is infectious, and non-communicable diseases. Now let's look at the significance and components of health infrastructure. Health infrastructure ensures a healthy workforce or healthy manpower for the production of goods and services. Scholars argue that health is a fundamental right and the government is responsible for ensuring it. Health infrastructure contributes to both preventive and curative care. What are the components of health infrastructure? Do you know? Okay, let me tell you. First component is medical facilities. That means hospitals, clinics, PHCs, that is primary health centers, dispensaries, and so on. Then next component is human resources. That means doctors, nurses, paramedical staffs, and community health workers. Third component, it is equipment and supplies. That means hospital beds, diagnostics, tools, surgical instruments, and so on. And the fourth component is pharmaceutical industry. That means for the development and supply of medicines and vaccines. So the government's vision is, since early stages of plant development, India aimed to ensure that no one is denied medical care due to inability to pay. And the current status shows gaps in coverage, accessibility, and quality which need to be addressed to achieve the vision. Okay, now state of health infrastructure in India. The Constitution mandates the government to regulate and guide health-related issues, including medical education, adulteration of food, drugs and poisons, medical profession standards, vital statistics, mental deficiency and lunacy. And the Union government, through Central Council of Health and Family Welfare, formulates broad policies and plans. It provides financial and technical assistance to state governments, then union territories and other bodies of implementation of health programs. India has developed a vast network of health facilities and trained manpower at various levels. In the village level, facilities are primary health centers, sub-centers, dispensaries and so on. Hospitals are also there run by the government, voluntary agencies and private sectors. Manpower means trained doctors, nurses, paramedicals from medical, pharmacy and nursing colleges. In 1951 to 99, during 1951 to 99, number of hospitals and dispensaries has been increased from 9,300 to 43,300, and hospital beds are also increased from 1.2 million to 7.2 million. Nursing personnel also increased from 0.18 to 8.7 lakh. Allopathic doctors increased from 0.62 to 5.0 or 5 lakh. So we have achieved in the expansion of health infrastructure, and it lead to eradication of smallpox, guinea worms and near eradication of polio and leprosy. So you can link health infrastructure to human development, rural urban disparities and social welfare programs in your mains answers. And data from 1951 to 2000 provides a strong historical perspective to highlight the progress. Now, private sector health infrastructure. In India, the private sector hospitals, clinics, labs, pharmacies, etc., run by individuals or private companies, has become very powerful in the health system. More than 70% of hospitals are run by private owners. They control about 40%. They control about 40% of all hospital beds. Nearly 60% of dispensaries belong to the private sector. They provide care to 80% of outpatients. That means outpatients means those not admitted, and 46% of inpatients. Inpatients means those admitted. So they provide a care to 80% of outpatients and 46% of inpatients. This shows that most Indians depend on private hospitals and clinics rather than government ones. Now, the private sector is now involved in almost every health related fields. Medical education and training, that means many private medical and nursing colleges provides medical education and training. Then they provide medical technology and diagnostic labs like private labs, scan centers and so on. Then pharmaceuticals, hospital construction management, general healthcare services, etc. are also provided by the private sectors. Now, what is the size of private health enterprise? By 2001-2, there was 13 lakh medical enterprises or 13 lakh private medical businesses. They employed 22 lakh people. These More than 80% of these were single person or small operations like a small clinic or local pharmacies. Now, what about the problems in the private sector? They grown without much regulation or government control. So some private doctors are not registered or qualified and are called quacks. They are called quacks. Okay. They treat people without proper training, which can be dangerous. So the private health sector in India plays a major role and provides most healthcare services. However, it has issues of quality, affordability and regulation, making it necessary for the government to monitor and ensure safe and fair healthcare for all. Okay. Now, India's three-tier health system. What are those three tiers? Primary, secondary and tertiary. Each level has specific roles and facilities. So let's look at each of them. Primary health center. What is the objective of primary health center? It provides basic health services and preventive care, and the services included are health education about diseases and prevention, promotion of nutrition, safe food and clean water, maternal and child health care, immunization against major infectious diseases and so on. Auxiliary nursing midwife or ANM, they are the first person who provide primary health care in rural India. ANM is the first person, or auxiliary nursing midwife is the first person who provides primary health care in rural areas, and they have some facilities like primary health centers PHCs, then community health centers, that is CHCs, and other sub-centers, usually staffed by one doctor, a nurse and limited medicines. If the patient cannot be treated at the primary level, they are referred to secondary or tertiary hospitals. Now, what about secondary health care? Their objective is to provide more advanced medical care, including basic surgeries and diagnostics. And their services include surgical facilities, X-rays, ECGs and other basic diagnostic tests, handling conditions beyond the scope of PHCs. So district hospitals and hospitals in big town are secondary healthcare center, and they act as a link between primary and tertiary care. And what about tertiary health center? So their objective is to provide an advanced and specialized medical care. So their services include complex surgeries, treatment of diseases not manageable at primary or secondary level, and so on. And their facilities are premier institutes providing specialized care and training like AIIMS, All India Institute of Medical Science in New Delhi, then postgraduate institutes PJ Chandigarh, Jawaharlal Nehru Institute of Postgraduate Medical Education and Research Pondicherry, then National Institute of Mental Health and Neurosciences, in Bangalore, then All India Institute of Hygiene and Public Health in Kolkata. So primary care means their first contact, preventive and basic treatment are there. Secondary care means their advanced diagnostic and surgeries are there, district level. Tertiary care means specialized treatment, research, premier institutes are there. Now, since 1990s, what happened? Economic liberalization has led to private sector expansion in healthcare. Many non-resident Indians, that means NRIs and companies, especially in the industrial and pharmaceutical sector, have established state-of-the-art super specialty hospitals. These hospitals mainly cater to wealthy Indians, then medical tourists coming from abroad. Poor and lower income population still rely primarily on government hospitals for affordable healthcare. So the implication is, even with the growth of private sector, the government's role remains critical in ensuring accessible and affordable health services for all, especially the economically disadvantaged person. Now, impact of liberalization on health infrastructure in India. Since 1990s, economic liberalization has led to private sector expansion in healthcare. Now, many non-resident Indians and companies, especially in industries and pharmaceutical sectors, have established state-of-art super specialty hospitals. These hospitals mainly cater to wealthy Indians, medical tourists coming from abroad. Poor and lower income population still rely primarily on government hospitals for affordable healthcare. Okay. Now, indicators of health and health infrastructure, a critical appraisal. We know about the health indicators used to access a country, right? Infant mortality rate, maternal mortality rate, life expectancy, nutritional level and so on. India has a scope for significant improvement in all these sectors. Expenditure on health is only about 5% of GDP. Expenditure is just only 5% of GDP, which is very low compared to other developing and developed countries. Scholars argue that government needs to play a stronger role in improving infrastructure, that means health infrastructure and access to healthcare. So the implication is, despite building vast health infrastructure, low investment and limited accessibility, it hinders India from achieving better health outcomes. Okay. Now, India has 17% of world's population but carries 20% of the global burden of diseases, that is GBD. GBD is an indicator that measures premature deaths and years lived with disability due to diseases. So GBD, or global burden of disease, is an indicator used by experts to gauge the number of people dying prematurely due to particular disease, as well as the number of years spent by them in a state of disability owing to the disease. So we know about communicable diseases like diarrhea, malaria, tuberculosis, etc. account for more than half of India's GBD. What about child mortality? Almost 5 lakh children die annually from waterborne diseases. Malnutrition and inadequate vaccines causes 2.2 million child deaths yearly. AIDS is also an emerging issue or emerging threat. And also, less than 20% of the population uses public health facilities. Only 38% of primary health centers have the required doctors, and only 30% of PHCs have adequate medicines. Then 70% of population lives in rural areas, but only 20% of hospitals are located there. Rural areas have half the number of dispensaries and only 11% of hospital beds. In rural, there are only 0.36 hospitals for every 1 lakh people in rural areas, while in urban areas they have 3.6 hospitals for the same number of people. And the result is, rural population face limited access to healthcare, leading to inequities in health status. So the implication is, India faces major health infrastructure gaps and unequal access, especially between rural and urban areas, which affects overall health outcomes. Now, rural health infrastructure gaps and inequities in India, let's look at it. Primary health centers in village lack basic diagnostic facilities like X-rays and blood tests. Villages have no access to specialized care, and states lacking behind include Bihar, Madhya Pradesh, Rajasthan and Uttar Pradesh. Then percentage of rural population without proper care increased from 15% in 1986 to 24% in 2003. Despite 165 recognized medical colleges producing 12,000 medical graduates annually, rural doctor shortages persist. 1/5 of medical graduates migrate abroad, others prefer private urban hospitals. And the poorest 20% of Indians spend 12% of their income on healthcare, while the rich spend only 2%. Poor patients often sell land or pledge children to afford treatment. Lack of government facilities pushes the poor to private hospitals, leading to indebtedness or even death. So the implication is there is a severe rural-urban divide and economic inequality in access to healthcare. Health infrastructure development in rural areas is critical to ensure equitable health outcomes. Okay. Now, women's health in India. Women make up about 50%. Women make up about 50% of India's population. They face disadvantages in education, participation in economic activities and healthcare. Child sex ratio declined from 945 in 1991 to 927 in 2001, indicating rising female feticide. Around 3 lakh girls under the age of 15 are married and have already born children. Maternal health is severely affected due to early pregnancies, inadequate healthcare and nutrition. Over 50% of married women, that is from the age of 15 to 49, they suffer from anemia, that means largely due to iron deficiency. Anemia contributes to 19% of maternal deaths. Abortions are also a major cause of maternal morbidity and mortality in India. So the implication is women's health is closely linked to nutrition, early marriage, reproductive rights and access to healthcare. Addressing these issues is essential for reducing maternal mortality and improving overall health outcomes. So health is vital public good and a basic human right. Decentralized public health services can improve access to all citizens. Education and awareness on health, hygiene and preventive care are critical. Efficient health infrastructure ensures long-term success against diseases. Telecom and IT sectors. Okay, they play a supportive role in healthcare delivery and awareness campaign. Then primary healthcare is central to effective healthcare programs and their goal is to improve quality of life for all citizens. Private-public partnership, that means PPP, they can enhance reliability, quality and affordability of medicines and medical care. Then what about rural-urban divide and inclusiveness? There is a sharp rural-urban healthcare divide. Ignoring this can destabilize socio-economic development. Solutions must integrate accessibility and affordability in health infrastructure planning. So that's all about health. Now let's go to the conclusion part. Both economic, that means energy, transport, communication, and social, that means health, education, housing. So both economic and social infrastructure are essential for national development. Infrastructure supports all economic activities, increases productivity and improves quality of life. And you know that India has made a considerable progress in building infrastructure over the last 6 decades. And the distribution remains uneven. Many rural areas lack road, electricity, telecommunication, schools and hospitals. Modernization demands high quality infrastructure while considering environmental impacts. Reform policies including incentives and concessions aims to attract private and foreign investment in infrastructure. What about energy and health infrastructure? Both sectors show that there is scope for ensuring equal access to all citizens, reducing rural, urban and poor-rich disparities. So, infrastructure, both economic and social, is vital for a country's development because it supports production, trade and quality of life. India has made significant progress since independence, but its distribution remains uneven, especially in rural areas. Sectors like energy and health highlight the need for better access, efficiency and private-public partnership. Going forward, modernization, environmental consideration, and equitable access will be key to sustainable development. So that's all about this chapter. Hope you understand. Thanks for watching. For more related contents, do like, share, and subscribe.